COVID emergency declarations have come to an end after action by President Joe Biden last month. And soon the nation's public health emergency will end as well. KITV4's Paul Drew shows us what impact the end of the pandemic will have on Hawaii. Paul.
Well, the end of those emergencies will reduce some COVID monitoring and federal funds for Hawaii health programs. But even an official announcement isn't changing people's views of COVID or the protections they take against it. Masks are no longer required in public places, but many people still wear them, even outdoors.
I'm going to wear a mask regardless. I don't care what he proclaimed it's over or no. Me and my family are going to mask. My wife mask, my 2 kids, they double mask and they go to public school.
But for others, the end of the pandemic is long overdue.
I don't worry about COVID at all, actually, because I just haven't seen any craziness with my own eyes. I've heard a lot, but I haven't actually seen like hospitals being overwhelmed.
They want to get on with their lives already. They've done 3 years of this already. They're over it. I get it. I want to take mine off and just throw it away, but when you hear people getting it and some people, they don't do well. They're in the hospital. There's still people dying.
On average, over the past week, 1 person has died each day from COVID. Just a few of the nearly 2,000 Hawaii residents who died from COVID over the past 3 years. Even as this national emergency ends, some people may have lingering symptoms of COVID, what's known as long COVID.
Approximately anywhere from 10 to 30% of individuals will have symptoms of long COVID. When we think of adults with long COVID, we think of problems such as brain fog, fatigue. When you think about respiratory symptoms, we think of chronic cough, shortness of breath.
Doctors don't know why some people get long COVID and others don't even know how long it'll last.
I've had some patients that have long COVID, and after about several months, their symptoms get better and they go away. Then there's other individuals who have long COVID symptoms for years after.
But researchers have found who is more likely to get long COVID.
We know that if you're hospitalized, you have a higher risk of getting long COVID symptoms than if you were not hospitalized.
Even if you've recovered from COVID symptoms, you could still be at risk for developing long COVID later.
We're identifying people who are just saying, I'm so tired, and they come into their primary care doctor and said, I had COVID a year ago, and now they're coming to me now. Because sometimes it takes just a lot of time to get through the system. Now,
there are a number of studies underway to unravel the mysteries of long COVID. In the meantime, you're urged to see your primary doctor if you have any of those lingering symptoms after testing positive for COVID. Paul Drews, KITV4 Island News.